Okay guys, this is cardiovascular and peripheral vascular assessment. So the first thing that I'm going to do for this assessment is auscultate some heart sounds. So I'm going to put my stethoscope in here. We're going to start listening for the aortic valve. We're going to start on the right sternal border at the second intercostal space. Good. And then staying at that second intercostal space and moving over to the left sternal border. Listening to the pulmonic valve. And then if I come down a little bit to the third space, that's Erb's point. Moving down to the fifth intercostal space, listening to the tricuspid valve. And then staying in that line, but moving to the midclavicular line. That is our mitral valve. Good. And I'm hearing S1 and S2 there, which are the normal heart sounds, the love dove. Extra sounds would be S3 and S4. S3 comes after S2, it's an extra sound, and that is a ventricular gallop. There's also S4, which is actually an early beat. It comes before S1, and that is an atrial gallop. We can also hear a murmur. Sometimes it's kind of like a swooshing sound, and that indicates valvular disease or a valvular issue there. I'm going to go ahead and repeat this assessment with the bell side of my stethoscope here, and then we will turn to our left side after that. So again, aortic, pulmonic, move down to the tricuspid, and then into the mitral. Okay, perfect. Okay, and then I'll have my patient turn onto their left side. Okay. And I could listen again with both sides of my stethoscope. Go ahead and lay on your back again for me. Okay, and then I can go ahead and palpate the carotid pulses while I'm here. So I'm going to feel one at a time. And that's about a +2. And that's good and strong, and that's normal. She's not bounding or anything. There's no JVD or anything like that. I can also go ahead and listen with my bell for a bruit. And then take a breath for me and hold it in. Good. You can let it out. No bury there, and same thing. Breath in for me. And out. Good. Okay, nothing there. And that's normal. Continuing down, palpating some pulses. We can do our radials here. Good. And those are good and strong. +2. Brachial. Good there. Moving down, popliteal is here behind the knee. And those are palpable +2. Dorsalis pedis is on the top of this foot here. Good. Those are strong palpable. And then the PT can be felt kind of behind the ankle bone here on the inside of the ankle. And those are palpable +2. Good job. All right, I think that is it for my assessment. Thank you.